So, to show you a real example of how TLSN translingual neurostimulation can help achieve amazing results, I'd like to share a clinical case. We had a 70-year-old woman admitted to our hospital with a suspected current stroke. I won't go too deep into the neurological details, but a new stroke wasn't confirmed. The MRI showed some old stroke lesions from about 2 years earlier in the territory of the right posterior cerebral artery, plus signs of several small strokes. Since there was no new stroke, she didn't qualify for the vascular treatment program and was supposed to stay in the department only for a short time. Still, all our patients have to be seen by a medical psychologist. When I first met her, she was extremely emotionally unstable, crying a lot, unable to express herself and generally refusing to talk. It wasn't clear what was behind this reaction, so we spent quite a bit of time on a psycho-correction session, and eventually it became clear that before her stroke she had lived a very active social life. She was a film director, the author of over 30 films, the head of several public organizations, very active, always involved in social works. But after her stroke, even though she didn't have any motor problems, her arms and legs worked fine. She completely withdrew. She stopped leaving the house and lived with the help of social worker. Based on the location of her brain lesions, I suspected she might have some visual issues that had been overlooked. I gently suggested this to her, and that's when she finally opened up. She told me that her previous clinic she was advised not to mention any visual problems, otherwise they said she'd be sent to a psychiatrist instead of neurologist. So she'd been too scared to tell anyone about it. We did a brief screening focusing on visual gnosis using parts of the Luria battery, and it turned out she had total visual agnosia. She could not recognize faces, numbers, letters, or real objects, and she could not see a picture as a whole. She told me she recognized hospital staff only by their voices, and me, for example, only by the color of my hair. We then ran a full neuropsychological assessment, and it turned out that all her other cognitive functions were pretty well preserved. The main issue really was her visual agnosia. We only had 5 days for sessions, which is extremely short for neurocorrection. So we decided to add TLSN to try to wake up some of the compensatory mechanisms that had developed over the 2 years and had become, let's say, a bit stuck. We worked with her every day. Her main perceptual channel had always been visual. I even tried to recreate what she was seeing. On the left, a normal image, on the right, roughly her perception. She had complete loss of the left peripheral visual field, very poor vision on the side, lots of duplication of objects and simple visual effects like flashes and dots. Some objects she saw on the left appeared on the right. She could not recognize realistic or unrealistic objects at all, and faces she said that when she walked down the street, she sometimes saw people's faces distorted into scary grimaces like gnomes, as she put it. Naturally, she was terrified. During our correction sessions, the goal wasn't full restoration. During our correction lessons, the goal wasn't full restoration of visual perception. That would be unrealistic in such a short time. Our aim was to help her differentiate between what was real and what was a visual distortion, using her preserved frontal functions and feedback from me, because it's very hard to tell when your eyes are lying to you. We did 5 sessions in total. Even after this short time, she showed improvement on the screening scales. But the best proof that our work really mattered came a month later. She sent me an email. At the beginning of treatment, she could barely write. She was actually afraid to try. Of course, there were still some mistakes, but the message was clear and meaningful. She even wrote that she was planning to invite me to a film festival, which means she is returning to her professional life. That was the greatest reward. So, to finish, I just want to say, let's not be afraid to use new methods, especially those that are evidence-based. And let's never hesitate to help when we have the chance to make a real difference.